Hi, this is Dr. Taylor. So your hip joint is an incredibly deep joint. You have to know the joint layers, number one, right? So the first layer is all the muscles that surround it, the glute maximus, the glute medius, the piriformis, right? Everything that runs over the hip itself. Then number two, you gotta know that there are ligaments in bone, right? So the femoral head goes into the acetabulum of the hip. That forms the hip joint with the ligaments that hold that together. Then the third layer of depth is the labrum and the cartilage deep inside, right? So if you have wear and tear on the hip joint, arthritis, labral tear, cartilage damage, etc., that can all cause hip problems, as well as the ligaments and the muscles, etc., right? So number two, that comes down to the fascia. Fascia is collagenous, sticky tissue that wraps all the way around all the muscles. You can have a fascia problem due to adhesive scar tissue in your IT band or your glute or your back, and that can throw off the hip joint and cause problems deep inside the joint. So you want to get all that cleared out. That's why we're doing class 4 laser right into the hip joint. The laser can pierce that depth and bring blood flow into your hip joint to promote healing within the hip joint. A great potential non-surgical way to avoid pain. Right? Number three, spinal nerves. Even the nerves from your back, L5, S1, L4, L3, etc., can all run down. And if you have stenosis of the spine, nerve irritation, radiculopathy, subluxation, etc., that can cause issues in the hip, disc problems as well. So know the layers of depth with the hip, right? Great first glimpse at just how deep the hip joint is. If you need any help and you're suffering with hip pain, my treatment protocols are designed to reach that depth to deeply address the hip issue and hopefully do everything possible to avoid any unwanted invasive procedure, right? So this is Dr. Taylor. If you have any questions, don't hesitate to give us a call, 310-891-0102. I would love to sit down with you and talk to you about your hip pain. And remember just how deep the hip joint is.